Hi everyone, so I am Hidayat Faizin. Today I will be presenting my reflection based on Psychopharmacology webinar I attend. I will go through 4 main questions as guide. So the first one, what is the one key concept or insight you gain from the webinar on Psychopharmacology? One key concept I gained from the webinar was the idea from patient-centered prescribing. Before this, I thought psychopharmacology was mainly about choosing the right drug for a disorder. But this session taught me that effective prescribing involves more than that. It's about understanding the patient as a whole. Their history, their preference, and even their lifestyle play a huge role in treatment. This stood out to me because it shifted the focus from the medication to the relationship and communication between the healthcare provider and the patient. That kind of approach makes the treatment more human and more effective. So for the second question, how has the session deepened your understanding of how medication affect brain function and behavior? So, this webinar really helped me understand how psychiatric medication affect neurotransmitter like serotonin and dopamine, which in turn influence person mood, thought, and behavior. I also learned that medication doesn't work the same for everyone. For instance, two people with depression might take the same antidepressant, but one improve while the other doesn't. This because things like genetic, the dosage, and even the physical person or emotional condition can impact how well the medication works. It's made me see how complex and personalized psychopharmacology is. It's not just a science, it's also about tailoring treatment to the individual. So for the third question, discuss any ethical or social issue related to psychopharmacological treatment that were mentioned. There are several important ethical and social issues were brought out during the webinar. This include informed consents, the need to explain side effects clearly, and the challenge of make sure the patient truly understand their treatment. Another issue was access to medication. Some people can afford or don't have access to quality mental health care. Also, the stigma around psychiatric drug was discussed. How people sometimes avoid medication out of fear of being judged. This point made me realize that we can just focus on the medication itself. We also need to look at the bigger picture, how fair, respectful, and accessible treatment is for everyone. So for the last, did this session change the way you view the role of medication in mental health care? Why or why not? What question or curiosities the spark for your future learning or career? For my answer is yes. This session definitely changed how I view the role of medication in mental health care. I used to see medication mainly as a way to control symptoms, but now I understand that it's part of larger, personalized and ethical process. This session made me think more deeply and how future treatment might become more customized, maybe using a genetic or other biological marker. It also made me curious about how mental health professional can do more to reduce stigma and educate patients about their option. Overall, the webinar was eye-opening and gave me deeper respect for the complexity of psychopharmacology. So that's all from me. Bye. Thank you for watching.